Okay, so good morning, everybody. Assalamualaikum warahmatullahi wabarakatuh. I would like to say my warmest greeting and regards to Dr. Satvinder Kaur, who is an associate professor at the UCSI University Malaysia from the Department of Food and Nutrition Science, that have been here with us today to share an insightful lecture on chrononutrition and its impact on general health and several health outcomes. Um, for your information, Dr. Satpinder, in this session, we have first, second, and third year students of our nutrition study program. And well, this is not something that I'm proud about, but we have some sort of traditions that whenever there's a lecture, there's always students who are late.
That's
So
normal everywhere.
it, it seems like we also have some students who may be joining us late because
No
we
worries.
see that some students are still joining. So I hope it is okay for you and that we can still start this session today. And the rest who want to join later can join later. Okay. But first of all, I would like to greet my students. Hi, everybody. Hi, students. We have first, second, and third year students here.
Okay.
And if you don't mind, so that we can see your gorgeous faces, so Dr. Satvinder can know the faces of the nutrition students at the University of Indonesia. Do you mind turning on your camera? In a minute, Kak Novi will help me, Kak Novi, to make a screenshot of the participants for attendance list of this session.
Yeah,
So
you have a very big number of students, yeah? So these are your
yes,
final year nutrition students and your master
mhm.
students.
This is the first, second, and third year students.
Okay.
We have 4 year, first year,
Okay.
second year, third year, and fourth year.
Okay.
And for each year, we have approximately 50 to 60. So in
Mm,
total, we have almost 200 or
yeah. Okay.
200,
There.
200 plus something. Can you
Oh.
hear my voice well, Dr.
Yes,
Satvinder?
yes. Yeah,
Okay.
perfect. Yeah.
Yeah. And but the attendance of this lecture is mostly the first, second, and third year students, because our final year students is currently busy taking data for their final projects. So they are not in the university campus anymore, because while they are busy everywhere in their research site to collecting data for their final projects. Okay. Kak Novi, are you there, Kak Novi? Kak
Yeah.
Novi.
Yeah.
Okay. Okay,
Okay.
thank you, Kak Novi. Can you help me first to take a screenshot of the students for the attendance list? We can sort out later which one is from the second, first, and third year students.
Yeah. Can you also share with me later your screenshots?
Of course, we will. Okay. Please, Kak Novi.
There's 5 of them in one screen.
Okay.
Okay.
Slide one. One, two, three.
Okay.
And slide two.
Okay.
Slide two.
One, two, three. Okay. Okay.
That's
That's
all.
all.
Okay.
Yeah.
Thank you so much, Kanofi, for taking the attendance list. Maybe because I see that we are still half of the class. Maybe later at this lecture we will take another attendance list. to make sure that everybody who are attending this session is recorded. And students, so in a few minutes, we will hear the lecture by Dr. Satvinder. This is something that is very important because actually, as the head of Department of Nutrition Study Program myself, I have to admit that chrononutrition is something that we haven't really taught in the department yet. So this is something that is a very sexy topic in the global nutrition issue. And we are happy that in here we already have Dr. Satvinder, who is an expert in the field of chrononutrition, to teach us introductions on chrononutrition and its impact on health outcomes. Please be ready to taking notes because you will have to submit your resume. And this is also something that, well, I hope that you thought these sessions as not an obligation, but also a chance to really learn outside what the university has taught you. Because in the university, we are probably still limited in teaching all topics, all trending topics, all current issues in nutrition, because we have some sort of regulations driven by the governmental requests on what a nutritional graduate should have as in the competence, but this is something that you still have to know besides what we already teach in the university. Okay, I think that's all for the introduction. Now I would like to give the opportunity to Dr. Satvinder to introduce yourself and also share your lecture.
All right. Thank you. Thank you, Dr. Fatima. I think firstly, yeah, thank you for this kind information, and I'm really honored to be here today. And it's good to know we have more than 100 students listening. Wow, good. Very good job. Students they're very supportive, and I think that's a very good sign. Yeah, I like what Dr. Fatima said. She used the word sexy topic. Indeed, yeah. So chrononutrition is something I would say it's an emerging field in the field of nutrition, because today a lot of things are changing in our life. Okay, in the sense of the way we live, is no longer the traditional. So I'll walk you through my presentation today. Allow me to just share my screen. Okay, where's my screen? Yeah. Right. Okay. Okay, can you see my screen?
Not yet. I think it's still loading.
Not yet.
Not yet.
Not yet, huh?
Still not yet. I'm not sure. Students, can you see the slide? Charlene, can you see the slide?
Not yet, Miss.
It's okay, Dr. Satvinder, take your time. And if you find difficulties in sharing the screen, maybe you can also send your slide to me.
Do you know what happened? Let me try again.
Okay. It's okay, take your time.
Yeah, where is it? Okay, all right, can you see my
Yes.
screen now?
Now we can see your slide, but it's still not in the presentation mode.
Yep.
Okay, now we already see it clearly.
Better, yeah?
Okay. Yes.
Right. So, yeah, so my name is Atwin. I'm an associate professor with the Faculty of Applied Sciences at UCSI University. So we are one of the leading private university in Kuala Lumpur, Malaysia. And I teach students, undergraduate and postgraduate students, as well as I supervise students in the field of nutrition research. Yeah, so we do have like coursework and an undergraduate in the field of nutrition. So similar background. And yeah, I do a lot of work on chrononutrition. And this is a collaboration that or an effort that I have with for my friends in Japan. And I'm learning, so basically experts in chrononutrition and circadian rhythm is from Japan. And this is now emerging. You do have studies coming up, but not so much in Southeast Asia. But yes, I think it's time that we talk about chrononutrition and how this impact our health outcomes. Okay. So this is a little bit of a background of what I'm going to be sharing with you today. I'll introduce you to the concept of circadian rhythm and chrononutrition. I'll try to be as simple as I can be because I do understand that there's a diverse group here. You have from the first year student to the third year and maybe some postgraduate student. So I will try my best to keep it simple. Okay, although the slides may look complicated to you. Okay, and we talk a little bit on what other factors in our field of nutrition that could lead to the impact or the disruption in chrononutrition and how does this translate to overall health. Now, at the end of my slides, I would also be sharing a little bit of what I presented at the recent conference in Korea, ICOM. So that's one part of our chrononutrition research that we do. It's not limited to maternal, but mainly my chrononutrition work has been on maternal. We are expanding it to adults and now young female university students as well. Okay, don't be disheartened, males. We took females because it's a branch of a bigger project on anemia, but we are starting to study as well the chrono habits of females in universities. Now you would have heard this just give me a minute. I need to minimize this. Okay. You would have heard this before. Eat breakfast like a king, lunch like a prince, and dinner like a pauper, right? So this is a very ancient saying by Adele Davis, whereby there's a lot of advocacy of why breakfast is so important to a person's health. And, you gradually reduce your food intake in the day, okay? So it's basically chrononutrition is applying similar to this concept. Now, if you look at obesity, so I'm sharing with you the Malaysian National Health and Morbidity Survey data over here. So up to 2023, you can see that the obesity prevalence is going up. I just got back from Bangkok yesterday and there was a public health nutrition conference and there were countries from representatives from Indonesia, Thailand, Philippines, and the same was observed. I do see the similar trend that we are seeing a problem in our region. Obesity is going up. All right. And in the past, we have attributed the rise of obesity to these main four factors. Of course, calorie intake is the main factor. What we eat, has to be expanded. We don't burn the calories, it becomes, your body fat and you put on weight. And how do we expand this? We have to be active, okay? We have to do a lot of physical activity. And there's also studies that says that we could be, more at a higher risk if we carry some genetic predisposition. Okay, while this is not a main factor, but it could be a contributing factor. And there are also a lot of study looking at sleep, okay? And now we're talking about chrononutrition. Where does this fit in how it influences the this pandemic or this epidemic of obesity, okay? Now, this is again the traditional way of how we look at our dietary determinants. We look into dietary intake and we assess macronutrients intake, such as energy, fats, carbohydrate, protein, and we look into what are the consumption of specific foods that are pro-health and anti-health, for example, sugar-sweetened beverages, all right, and pro-health like foods that are coming that provides more monounsaturated fatty acids and polyunsaturated fatty acids, and complex carbohydrates such as fruits and vegetables. And then we look at dietary patterns. I'm sure some of you, maybe not the year one, but maybe your year 3, year 2 students, you would have somewhat heard about Mediterranean diet, a diet that is very, that has been shown to have good impact to a person's health. And this Mediterranean diet is also now being translated in Thailand dietary guideline, which is very interesting. They're using this concept of Mediterranean diet to mimic their local diet and how they can teach their people. So this has been a very good dietary approach, even in combating metabolic syndrome. And a diet that is fish and legumes have also been said to be a diet that is pro-health. And now we look at chrononutrition that is coming in, and you would have perhaps also heard about the concept of intermittent fasting. It's slightly different from the concept of chrononutrition, although it is similar, right? And all this looks into how does it influence body composition and fat mass, okay, in a person's body. Now, I take you a little bit back, to ancient times, if you've heard of Ayurveda or Ayurvedic practices and the Chinese model, the traditional Chinese medicine. So if we go back to ancient practices, they had been advocacy that we should not eat after the sun has set. All right, which is 6 p.m. normally, where the sun has set. So this is actually the time to go to bed, to get ready to bed, and to peacefully fall asleep. So in Ayurvedic clock, they have separated the eating type to 6 domains, and whereby they also emphasize that when a person wake up in the first 2 hours, they should start their day calmly, slowly, and start eating. And more food should be eaten at the noon time. So this is a very ancient practice that was maybe practiced by a lot of our ancestors back then. Similarly, in the Chinese model, they have looked into how the different organ would digest or would have an influence to the metabolic outcome, looking based on the time of the day. Now, if you look at even Indonesia dietary guidelines, similarly with Malaysia, we have always focused on what we should eat in terms of
Suaranya
the
kenceng dikit, sorry.
and we also have focused on in terms of the quantity of how much food intake has been actually consumed, right? Now, we are now talking about what time should we eat all this meal, and that's going to be a new branch. Now, if you go to the American dietary guidelines, in their most recent dietary guidelines, they have incorporated the concept of chrononutrition a little bit in their dietary guideline. Okay, now before we go in further, let's understand a little bit about the human body. Okay, why do we talk about chrononutrition? Why do we talk about time? Why can't I eat throughout the day? What's the reason behind it? So the reason is that we have a biological clock. Okay, maybe you don't realize, but if you consistently wake up at one time of the day, say you always wake up at 6 a.m. or 7 a.m. and you're quite consistent with your timing, you will notice that you maybe do not need an alarm clock. You will, suddenly your body will automatically wake up. So that's because your body has a clock. All of us has a clock, okay, and all our clocks can be varies greatly depending on our lifestyle and what are we exposing ourselves to. So if you look at the processes in the day, so there are 2 main hormones that you would hear me mentioning today, which is the first one is the melatonin and the other one is the cortisol. So they are opposite of each other. Melatonin is generally a hormone that prepares us to go to sleep. So it's secreted mainly a lot more at night. So if you see, it starts secreting at night, okay, and it goes in throughout the night. So the better we secrete melatonin, the better we sleep. Meanwhile, cortisol is, you would have heard about, the stress hormone, the wake up hormone, the adrenaline rush. So adrenaline is another name of cortisol. So when you are excited, you get excited, suddenly you feel your heart is beating, maybe you didn't finish your assignment, and then your lecturer is asking you, where's your assignment? And you realize my heart is pumping. So you are having an adrenaline rush. So you are having higher release of cortisol. So cortisol is a term called the wake-up hormone. Now, when you want to wake up in the morning, you must have cortisol. Otherwise, we cannot wake up. So when melatonin goes down, cortisol will go up, right? And here is where you see the sun and the moon. So when the sun rises, so if your room have, like light coming in, so the moment the sun rises, our cortisol builds up. Naturally, all of us have the same cycle. We have the build-up in cortisol and the melatonin based on our lifestyle, right? So this is how the mean pattern of the body temperature as well changes in the day. So if you look at the time of the day, early morning, we actually have lower body temperature compared to later time of the day. Okay. Now, all these hormones that I've just told you, or the secretion of it, how does it happen? How does my body know? How do I secrete melatonin, cortisol? It all comes from our brain, our master clock, which is already programmed, right? And it's at the central nervous system, okay? And then we have peripheral system. So the central nervous system will trigger or will kind of like, signal our peripheral system to do work based on time, like our liver, pancreas, gut, adipose tissue, and the skeletal tissue. Now, how does the brain have got the trigger? What triggers the brain to actually go into secreting? It's actually through the light and the dark cycle. So if you're in the sunlight, although you say, I must shut my eye, but no, when we sleep, right, there is some part of our eyelid is not totally shut, and that is depending on the phase of our sleep. So at certain phases, when we're in deep sleep, we do not emit light through our eyes. But when we are not always on deep sleep. I think if a person, even at best, you are in 40 minutes of your deep sleep. After that, your REM goes up again, the rapid eye movement. And then your eyelid actually open very minutely, and that some rays goes in. And that's where your body gets the signal. Okay, sometimes you're on the light, right? And you open your window. Okay, so those are the signal your body is giving to you, their brain gets on how I secrete this hormone. Okay. Now, when this regulation happens, okay, it then triggers our digestive and our metabolic enzymes, our hormones, our nutrient absorption, okay, our lipogenesis, glycogenesis. So all this will trigger the gastric emptying and the appetite hormone. And this translates to food intake. So if you wake up in the morning and then when your cortisol is very high, so cortisol is another hormone that in a way triggers it actually accelerates adipose tissue development, right? So you will feel hungry once you are a bit more awake, right? Once you get up, after the thing, trying to plateau, you will get your hunger pangs. It's time to start the day and to take more energy into the body. So this is the central clock, and this is the peripheral clock, which triggers through the central clock, okay? And this is how it will these processes will trigger the cues that we get. Now, the other thing I would like to highlight, every one of us have a different chronotype. You could be a morning person or an evening person, or what we call an intermediate, which means you could be morning and evening depending on your routine. Okay, some people, they're very evening, they're very obvious. What does it mean is that people who are morning are generally, they are more active in the daytime, and they are more, like for example, when you want to do your assignment, then you say, oh, cannot, I have to only do it in the morning. You're very active in the morning. My brain works very well. So you do your assignment in the morning, you're more productive. Some people say, no, I can't. I feel very sluggish in the morning. I'm very active when everybody's very quiet. The temperature goes down, and I'm active at night. So I like to do my assignment midnight, 1 a.m. So you are generally an evening person. So that's normally how when we ask questions, we distinguish between the chronotype. Now, the other thing to take note, if you notice, chronotype will change across, like when you're in school, I believe most of us were morning person. Why? Because we have to go to school in the morning, right? So we would generally be a morning person because our parents will also tell us to be morning. But if you see, when you come to teenager, Okay, when teenage, like I have a teenage son too. So there's a tendency wanting to be awake later in the day. They feel, oh, I'm better at night. In the morning, wake up to school, they feel like, I don't want to wake up, So there's a drop. So people tend to change the chronotype after that. And generally, it will enter up to early 20s. And after that, there could be another change. Now, what happens if you see this thing generally stops here? Because this, and there is a two symbol. It depends on whether you want to be a morning person or an evening person, because that totally depends on a person's lifestyle. For example, if someone is a shift worker, they cannot be a morning person if they have to work at night. So there's a lot of determinants in terms of social and work life that triggers or that determines a person's chronotype at this point, okay? So all these, our social schedules, our light dark cycle, our genetics, so there's also a genetic predisposition in circadian system, being a male or a female and ethnic group. So all this makes up our circadian clock system that will eventually have an impact to our cardiometabolic health outcome. Okay, so there have been various reviews that has been done, okay, by my team, and this is by one Dr. Henry. So this is looking at how the entrainment. Entrainment means, like a clock, we can program it, right? We can program it. So meal timing, food, nutrient components has been seen to actually impact in terms of the circadian clock system. So what we eat can entrain the system in a way. And of course, the most important part in entrainment is the light-dark cycle, how you're exposed. So if you on your light and sleep, you are generally triggering your body not to be in a deep phase. So the best place to sleep is in a dark room, pitch black, right? So that's when you give your body total darkness. But if you're on the light, it can actually trigger, okay, your body to wake. So you might have lighter sleep. And of course, shift work, how we sleep, the temperature in your room. If we are having very bad season, like the temperature is very hot, we are unlikely to sleep well too. We can tend to sweat. Okay, and social jet lag. So social jet lag is a marker whereby we determine what are the differences of sleep time from weekday versus work-free day. So even like students yourself, you have to go to classes on Monday to Friday. You have classes in the morning, but on Saturday, you don't have any class. So you can decide what time I want to wake up. So a morning person will still maintain to wake up in the morning, but a person who is more inclined to evening, they might have a very late night on Friday night and wake up very late on Saturday morning. So that's what we mean by social jet lag. Anything more than 1 hour from your routine is considered you're having a social jet lag. Now, there have been a lot of reviews and studies done that people who generally synchronizes their circadian rhythm well have good metabolic health outcome, meaning consistency, and those who have very bad desynchronization of their circadian rhythm will develop, they're at a higher risk of developing type 2 diabetes, obesity, and poor glucose control. Okay. So what are the disruption factors of chrononutrition? Okay, there are four main things. Skipping meals, especially breakfast. Eating window. Okay, so what does eating window here means is that, for example, if today you started your meal at 8 a.m. and you end your meal at 8 p.m., then you have a 12-hour eating window because you expose your body to food intake for 12 hours in the day. So the longer our eating windows are, the more it can impact our health, right? So it's advisable to have anywhere between 8 to 10 hours. Okay, so yes, you might be thinking, I cannot have breakfast very early. If not, I have to have my dinner very early. So you have to, if you eat very early, then you have to end your meals very early. Okay, preferably maximum is 12 hours, nothing more than that. So 14 hours and more is considered you are exposing your body to food consumption longer than it's needed. So why? Then you are literally asking your body to digest, metabolize. Basically, you're overworking your system, right? So you should be rested. So this is also the concept of intermittent fasting. But intermittent fasting differs because it doesn't go with the time of the day. So intermittent fasting is like I can eat any time of the day as long as it's 8 hours, depending on the timing that they want. But in the sense that chrononutrition, we advocate eating early morning. Morning meal must be there, right? and finishing your meal early evening. Okay. And looking at meal frequency, how many meals that a person eats in a day. So if a person has smaller meals, then it has to be ensured that the meals are smaller, but the density of the meals are lower. Okay, so if you have 6 meal frequency, but your 6 meals carries, like every meal is 500 kilocal or more, then you are loading. The meal frequency will be correlated with energy, higher energy. So if meal frequency is smaller, then it has to be spread out in the day and it's distributed well. So it depends on how this is done. Okay. And so what it means here, it doesn't mean if my meal frequency is lesser is good, right? It can also mean that you could have a more frequent meal intake, but they are generally smaller and they are generally more having higher quality. Okay. And miss time meals, okay, eating breakfast after 12, and having not having, say, dinner, not having snacks. Definitely one of the main thing of the miss time meal is always breakfast, skipping lunch, and then having a very heavy meal in the later day. Okay. So when we look at the circadian changes, the chrononutrition, okay, so as I mentioned, our sleep will trigger our meal time. So when we say, how do I determine what time to eat? This meal timing is never a stand-alone thing. In fact, we never say that, oh, because I want to eat at 8 o'clock, I must sleep at this time. It's the other way, right? We always say, okay, I'm going to sleep when I wake up, and then I will see what time I want to eat. Okay, so our sleeping is always pretty consistent. We generally would go to sleep. We never plan what time to eat based on what time to sleep based on what time to eat. It's always what time I sleep, and then after that, what time I will eat. Okay, so the sleep is always the mediating effect. Okay, it's an indirect effect. And if you look, and we look at synchronization on the circadian rhythm, because and how does the synchronize this rhythm is determined is through the release of hormone. So if it follows the pattern, then generally they are more healthier. And if it doesn't follow, it's desynchronized, meaning it's attenuated, it's not very high. There's no peak release of the hormone. Everything is very, low and then drop. Okay, and that's called deattenuation. And that's attenuation, and that's can see that it's higher risk to metabolic disorder. So when we look at the first one, the missed time meal, okay, so nocturnal eating is a concept where a person eats at night. And do you know what is a nocturnal animal? Like rats. Okay, rats are nocturnal animals. So if we do experiment, that's why having a rat is actually always is my studies are preferred, because they can be tested at night, daytime. Okay, they actually like to sleep in the day. They are awake at night, because they come under this group of nocturnal animals or organism. Okay. And nocturnal eating means a person who eats at night. And it has been seen that people who are eating at night craves more for energy-dense food. Okay, they crave. Why? Because at night, it's supposed to be melatonin is secreted. But because the body is being forced to remain awake, cortisol has to keep on being released. Cortisol is the only hormone that keeps us awake. If our cortisol drop, we will be sleepy. We want to go to sleep. So the trigger is the light. The light makes our cortisol being released because we are forcing now our body to be awake. And then there will be craving. And cortisol, as I mentioned, is a hormone that actually kind of like it accelerates adipose tissue deposition, right? And for that, you will crave for foods that are higher in energy, higher in fat, okay? Now, if you've been to Spain, okay, if you've been to Spain, Spain generally has this thing called siesta. Okay, so siesta is when after they eat lunch, they can go to sleep. Okay, so their lunch can be classified up to 3 p.m. And if you go to Spain, right, if you really go to those very small cities, they diligently practice this habit whereby between 1 to 3 p.m., they actually, it's a lunch hour, they eat and they sleep. Okay, so most societies, so their lunch is go up to 3 p.m. because that's also after I eat, I will sleep. Okay, and that's the time that they have classified it. And on the other hand, brunch is also very common. I'm not sure in Indonesia, but in Malaysia, brunch is also very common. So you see, we don't eat lunch, we don't eat breakfast, we eat brunch, okay, because we combine them, and this can be anytime between 11 a.m., sometimes 12 p.m. Okay, so but if it goes into 12 p.m., then that's considered a meal skipper, breakfast skipper. So peak energy intake must be before 3 p.m. All right, because it's been shown to lower the total daily energy intake, and people who eat generally focus on a higher dense meal or energy intake more before 3 p.m. They have higher diet quality index, and they will have lower energy dense diet, and they have a more structured meal pattern. Okay, and this is been seen in several studies that are done. Okay, so artificial lights will actually mistime our meal. And if we expose ourselves a lot more in artificial lighting at later in the day, we will then disrupt our meal patterns time. Then comes this thing called late night eating. So there is been, if you go into the literature, you would find a lot of papers on night eating syndrome and weight studies, weight issue. That's actually, a night eating syndrome has been studied for some time, but it was never termed as chrono at that time. It's just that people eat at night. So after observation and looking, obese people tend to consume most of their calories actually when it's closer to their body, want to secrete the melatonin, which is actually around 8 p.m. So what happens after 6 p.m., the sun sets, the body tend to build up, right? And this was seen that obese people, they increase their diet intake. So too much, that means compared to lunch or breakfast, the high energy is in the dinner time. Okay, and individuals with later chronotypes were more likely to have larger lunch and dinner, and they tend to skip breakfast because they don't feel hungry. They always say that, no, I'm not hungry, so I don't need to eat. All right, so, but that is because they've eaten a lot at night and the body is still, having enough reserves, so they tend to delay their hunger in the morning. And people who develop insomnia, whereby they cannot sleep at night, they tend to eat at night, because actually it's a very common thing. Even if you could, experiment on yourself, if you do try to be awake past 12 a.m., you would be hungry, okay? Because our body needs some kind of a boost to keep us awake. If it's very rare, people don't eat when they stay up late at night, okay? And sleep quality, okay. When we look at the aging process, generally it would decline. Cannot sleep like a baby when you are getting older. You may still, for all of you, you may still at a peak of your youth yet. So you still generally have quite good sleep quality. But if you compare to people who are older in their 30s, 40s, 50s, it would tend to decline because of changes in hormonal. And that could also be a contributing factor if it's not managed or creating awareness. Now, this was a study done in Singapore, whereby they look at the daily energy intake percentage among pregnant women in Singapore, and they can see that between 7 a.m. to 11 a.m., 25% of them consume most of their energy here. And we can see between 7 p.m. to 11 p.m., it's big, 32% actually consume their energy. The daily energy intake is coming from at this time. And 1% is between 12 a.m. to 6 a.m. But this was done only in a pregnant women. So adults who actually consume more than 1/3 of their total energy intake in the evening are more likely to be obese. So those who like to eat late at night and skip breakfast, they have higher risk of developing metabolic syndrome too. Night owl will always be late night eaters. Late owls cannot be, they need something. So it's generally a very normal physiology process. So late night eating is not a factor to weight gain, as the evidence are quite mixed, but it does contribute to poor metabolic health in the long run. So how about we eat closer to bedtime? Is that okay? I sleep at 10 p.m., but I want to eat at 9 p.m. So this is another point we should consider. So it has been seen that this could also be another contributing factor. Okay. Now, when we look at breakfast skipping, it's quite evident in the work that I do, in the work in the literature. We can see that breakfast skippers are not having very good glycemic response. And this was studied extensively among shift workers. Okay, they were weight gain, and these metabolic disorders are quite evident. So the consumption of calories in the morning is associated with the improvement in fasting glucose, insulin, triglyceride. Okay, it also showed greater glucose tolerance and less hunger. So when people skip breakfast, okay, they will have, why? Because that's the best time the glucose response is in the morning, okay? And the body is actually very effective and very productive in the morning compared to later time of the day. So although it's inconclusive that breakfast eating is a direct role to weight loss, applying the strategies may help. For example, if you know someone has to eat their meal, to maintain their health, they should consume more energy in the morning because you have more time in the day to expend that energy out. For example, you have a very big breakfast. You know you have several hours, but imagine if you eat so big dinner at 7 p.m. Then you sleep at 10 p.m. Although you are ideal, because you are having a meal intake 3 hours to bedtime, which is ideal, right? However, your meal intake at 7 p.m. say was about 800 kilocalorie. Will you be able to expand that in 3 hours? Highly unlikely, right? And that could contribute to the weight gain. So keeping it small at dinner is very important, okay? So glucose and insulin metabolism were also more stable among those who eat their breakfast regularly because then the synchronization happened. So sometimes if you notice, if you're a frequent breakfast eater, and then you eat breakfast every day, then maybe one day, due to your timing, you could not eat breakfast, right? To adjust the aircon. Okay, right? And then you don't eat breakfast on that day. Suddenly you realize that you get these hunger pangs, like, something is being secreted, all these juices in your gastric get secreted. So that is actually normal because your body has been programmed. But if you don't have a very good habit of eating breakfast, you generally won't feel hungry in the morning. If you're a breakfast keeper, you notice that you will never feel hungry. You get up in the morning because your body is used to not eating anything. So we are always programming our body based on our social schedules, actually. Now, I give you an example here, okay, a pictorial. So can we all relate to this? So say this is 6 a.m. So we wake up and we start eating, we eating. We eat small snacks, we eat lunch, and then we end our eating time. So if you look at the timing that we expose our body, if we extend this to beyond 12 midnight, so we are literally eating throughout the day. The body has got no rest. Okay. So this is what we mean. Okay. Like some people eat at 1 a.m., 2 a.m., right? So when the body is resting, it's only here. Total rest, fasting. Okay. So that's not ideal because you are consistently requiring your body to metabolize, to secrete gastric juices, hormones to digest. Okay. So time-restricted feeding is what we call the eating window. That's between the first eating and the last energy intake of the day. So the duration is generally reduced. 12 to 14 hours is ideal. Anything above 14 hours is actually not good. Okay, to 10 hours a day. So this was a study done, okay, whereby they look at exposing, for example, eating breakfast at 7 and ending the dinner at 9. That's 15 hours per day. And this is looking at breakfast is slightly shifted later by, say, 3 hours to 10 a.m. and end the dinner at 5 p.m. Okay, and that's 8 hours a day. So this was a study done whereby they ensured there's a 3-day food diary collected, a diet day that's provided, okay, 1 to 4, using this timing. And they also put a CGMS. So CGMS is called Continuous Glucose Monitoring System. It's a type of device that measures blood glucose every hour. Okay, it's a wearable, just like we wear like an armband. Okay, so they collect the data to see the glucose metabolism and regulation. So they found that those who are in this TRF group, they have improved nocturnal and post-nocturnal means nighttime blood glucose control, and postprandial means after meals. And this protocol was well accepted by the men who participated in the study. So that's a very important point for us to take note, because often when we do interventions, people are often not compliant. We have a lot of issues that people say compliance is one of the biggest issue, but by just asking them to introduce and giving them standard meals that they generally consume, considered healthy, nothing too drastic for their taste buds, and you applying this, we could also see some significant changes. Okay. So what happened is delaying breakfast just by 1 hour, okay, to fit in the 8 to 10 hour per day. If a person wake up early, then by delaying it, and having a dinner slightly earlier by 1.5 hours. So a lot of changes can be seen in terms of the body composition, the visceral fat, glucose homeostasis, and even the insulin function, the inflammation marker. So that is one of the factor that can be used as a strategy when we look at dietary guidelines, one, and in terms of dietary management, apart from dietary intake. Okay, so I'll just let's watch a very short video. Please tell me if you cannot hear this audio, but I think it should be fine. Is that okay?
Yes,
Metabolic syndrome,
we can hear well.
or METS, is a set of symptoms that increases the risk for diabetes, heart disease, and stroke. METS is defined by at least 3 of these 5 symptoms: obesity, excess abdominal fat, abnormal cholesterol or triglycerides, high blood pressure, high blood sugar. Many METS patients are on 1 or more medications. They are advised to eat less and exercise more. But these lifestyle changes are hard for many METS patients to follow. Recent research in circadian science suggests that erratic eating patterns can contribute to METS. Most Americans eat over 15 hours a day, from coffee with cream at 7 a.m. to a bedtime snack at 10 p.m. We wanted to test if limiting daily calories to a consistent 10-hour window could help METS patients better manage their disease. We recruited 19 patients with METS. After a 2-week observation, they were asked to pick a 10-hour window of time and eat within that window for 12 weeks. Most people chose to delay breakfast and advance dinner by 1 to 2 hours to eat within a 10-hour window. They did not skip breakfast or dinner. Their meals became more consistent, and they could eat this way for at least 5 days in a week. At the end of 12 weeks, we found several benefits of a 10-hour time-restricted eating. Each person improved in at least one of the criteria for metabolic syndrome. Many lost weight and reduced abdominal fat. Some reduced their blood pressure and cholesterol. People with high blood sugar had more stable blood sugar levels. This pilot study shows that 10-hour TRE may help people with METS manage their disease, and it lays the foundation for rigorous randomized clinical studies.
Yeah, so this was one interesting study, or a conclusion from the study, whereby they looked at the hours of consumption of food, okay, more than 14 hours and less than 10 hours of fasting. So we can see that with metabolic syndrome, okay, this is the baseline. They have high waist circumference, blood pressure, blood glucose, high triglyceride, and low HDL. And with the 10-hour eating time, which is just the start from morning, okay, you can see. So the concept of morning is still there, right? So this TRE embedded the timing of the day as well. And that's the point that I also would like to highlight, not just on TRE alone. Okay, so TRE, some people apply TRE by eating from 1 p.m. Then they extend up to night. No, that's not a suitable one. You should start in the morning and early in the day. And the concept should still be consistent with all the dietary guidelines. So they can see that there's a consistency in their daily rhythm, in their meal time, and their fasting levels improve their metabolic pathway rhythm, and can improve even they are said that it can improve their pharmacotherapy efficacy in terms of their drug. If they're consuming any medication, it can actually help them better. Okay, so now we look a little bit on energy metabolism and circadian rhythm, morning versus evening time. So after a meal, the metabolic processes showed the time of the day variation in. We can see that in the earlier, there's been faster gastric emptying, enhanced intestinal absorption, improved glucose tolerance, and they can also seem to have higher energy expenditure. So the factors to higher TEF in the morning is because when we are up earlier in the morning, you would move. The moment your body starts moving, you would actually need higher energy intake in the day. Okay, so this will increase the sympathetic nervous system activity. And at the same time, it will also increase the meal size. Because when you're, moving in the day, so a person who wakes up earlier in the morning will automatically need energy to move about, right? And there is an endogenous circadian control, whereby the changes in the day or the night exposure and sleep-wake time would adjust generally what you see in shift workers. That's why shift workers were a good model to look into what happened. So they are forced to change the way they sleep and wake up due to their timing. And then it's observed how does it fare in terms of their metabolic health. They may be getting the 8 hours of sleep, 10 hours of sleep in the day, but it's not the same as a person who sleeps at night and wakes up in the morning. Yeah. So we can see that this was a study done in people who have the breakfast group, okay, and they eat breakfast the highest. You can see 700 kilocalorie breakfast is consumed. And the lunch is only 500 kilocalorie, lesser than the breakfast, and dinner is only 200 calories. So smallest meal of the day is dinner, right? And there's a significant weight loss that we're seeing among those who had 50% of their daily energy intake during breakfast. Meaning if breakfast is the largest meal of the day, they notice that people lose weight better compared to having people who are maybe having similar intake, or maybe their breakfast is the smallest meal. So contrary to this study, naturally, most of us, 80 to 90% of us, our biggest energy intake is never breakfast. Instead, it's either lunch or dinner. That's our main meal we term as. Okay, breakfast is always smaller. So this is one study that showed that people who want to lose weight, they should look into just eating more in the day, their allowance, and smaller meals actually at night. They also see greater satiety among those who load their calorie consumption in the morning. So they feel full longer. They have very good satiety and able to retain them for the rest of the day. So when we look at the circadian role in diet-induced thermogenesis, so what does thermogenesis here means is that, for those who are not familiar with this term, yeah? So every time we eat our food, right, we will actually need some energy. Our liver, our intestines, need some energy to digest that food. So that's called thermogenesis, okay? And the diet-induced thermogenesis can be also influenced by our endogenous circadian system, and not because of our sleep-wake cycle. And it's not about our sleep, but what's been programmed in the body. So the difference between those who were aligned, so this is circadian alignment protocol, yeah? So in day one, you notice they wake up at 11, okay, and they are exposed to so lux here means the intensity of light. So you see in the morning, they are exposed to a higher intensity, and at 11 p.m. they have 0. Then by 11 o'clock, they are put in a room that is dark to entrain the clock, okay? Because the moment the light and the dark is the biggest factor in our body entrainment of our circadian system. And at day 2, right? At day 2, so here they are given meal at different time. And here they are given some test meal assessments, okay? And then day 2, they were given between in the morning, and then given some snacks, again, a normal meal. So this is a meal that they want to test, right? And then again, all dark, similar. And on day 3, there's no test meals, right? And then at day 4, they put them in consistent light. That means they are kept in a room that the light only emits about 4 lux, which is not quite dim. It's not dark, it's just dim. So you might be kept in a room with no windows, but with a very dim lighting throughout the day, and then darkness at night. And then day 5, they put them in not in high intensity, but with light, maybe can be like our normal room light, okay, and things like that. And up to 11 p.m. But again, no natural light here. So all this yellow is no natural light, okay? Because natural light is always, the lux are always higher. So this is the alignment protocol, and this is the misalignment. So if you see, they disrupt it. So it's quite inconsistent. So to disrupt the circadian rhythm, you see the darkness comes in the daytime. Sorry. The darkness comes in the daytime. So the moment we keep ourselves in a very dark room in the daytime, we are disrupting our system actually. So there is a between the aligned and the misaligned. Okay, so it was not significant after several days, and this conclude that the short-term misalignment actually does not impact the diet induced. So if this happens, say 1 or 2 days, maybe, you travel, right? You travel and then you come back and then you sleep at this time, right? You sleep for maybe 1, 2 days. So sometimes people who have this jet lag, they use the term jet lag, they cannot function in the morning. They need to sleep. So they need to sleep. They close all the window of the light and they sleep. So this 1 to 2 days have got no significant impact. But if you consistently do this, then the outcome is more at the long term. Okay. So you can see that the timing of caloric intake associated with variation in diet-induced thermogenesis and in the metabolic pattern. So this is a randomized crossover study. So you can see that these are those in the morning and these are the evening times. Okay. So you can see the glucose levels are generally higher in those of our evening time. So similarly here, okay, in insulin, the secretion of insulin is higher among those who are in the evening time. There is a decreasing pattern, but it's always higher than the morning person. So this study showed that the same meal that is consumed in the morning and in the evening showed that diet-induced thermogenesis is always higher in the morning versus the dinner. Okay, so it's always higher. So the metabolic responses such as greater glucose and insulin were also found to be higher in the evening compared to morning. So in studies looking at diabetes, they have seen that the best time to actually regulate blood glucose level is in the morning. So loading carbohydrate in the morning is better than loading carbohydrate in the evening. So preferably during evening, maybe can be more protein-based as compared to morning carbohydrate based, because that's where the body is most efficient in digesting, metabolizing, and creating a more stable blood glucose and insulin rhythm. Okay. So now I introduce you to another term called eating jet lag. Okay. So eating jet lag, I just mentioned the word just now, social jet lag. Social jet lag is the difference between what time you sleep on a work day versus a work-free day. Because all of us here are lecturer and students. So generally our schedule is Monday to Friday, is consistent, right? We have classes in the morning and we take a break on Saturday and Sunday. So Saturday, Sunday is our work-free day. So the difference that we are doing on Friday to Saturday and Sunday to Monday. Okay, that's what we call a jet lag. We measure in terms of that. Okay. Now, eating jet lag is a new term that we look at. What is the difference in meal time versus work day and work-free day? Okay, they are similar routine. So normally what gets altered mostly is the breakfast. And it contributes greatly to internal misalignment. So if you look at this diagram here, this is the eating period on work day. This is a sleep. Okay, they sleep on work day, then they wake up, sleep only about 6.5 hours, then up, and then this having the main meals anywhere between 8 to 8:30 p.m. a.m. And then this is the eating period, all the eating. I mean, eating means it's not eating continuously, but like the eating windows. They could have a snack at 11 o'clock, and then having a main meal at 1:30, then again having some drinks, snacks, anything in between, right? And having another main meal at 9 p.m. Okay, and then sleep period, sleep at midnight. And then weekends, this person doesn't want to get up early, doesn't want to get up at 7. Now, this person now gets up at 9 a.m. All right, gets up at 9, and clearly they will shift the breakfast, all right, and then eating, and then we'll shift the lunch, right? And if you see dinner is not so shifted, and this is a similar thing we found in our analysis too, in the study that I'm doing among pregnant women. We do not see the changes so much in the dinner time, but a lot of time, the most shifted is always breakfast, and there is some shift in the lunch. So this is what we call eating jet lag. Anything more than an hour, the eating period. Okay, so this is eating midpoint. Eating midpoint means we measure from the start of the eat. Like for example, here 10 a.m. And this is say at 9 p.m. So 10 to 9, what's the midpoint of the day? The middle point is here at around 3, right? And on the other hand, this person starts at 8 a.m. and ends at also at 9 p.m., close to 9 p.m. So what's the midpoint? So this person's midpoint is somewhere here. So this gap here is eating jet lag. So anything more than 1 hour is not favored. So any person that has more than an hour difference, we term that of having eating jet lag. Okay. But we can also classify it as breakfast jet lag, lunch jet lag, dinner jet lag. But this is overall eating jet lag. Okay. So this pattern could contribute to metabolic desynchrony. So the internal misalignment could be the factor that increases the risk of obesity due to time of meal difference between work and work-free days. So this is the delay normally. You can see that's why I said breakfast is more often the most delayed. And what is maintained higher is dinner. Dinner is the most maintained. It's generally similar. So eating midpoint that was assessed in this work was delay. All right. There is quite a number, about 40% delayed. They are eating midpoint. Lesser maintained, and on some only advanced. Advanced means they eat earlier instead of delaying it. Okay. So the breakfast is the highest and eating midpoint is the highest. Okay. So when we look at the central and the peripheral clock, okay, so the muscles will get is getting misaligned. So you see the pattern. So aligned means is a nice curve here, but misaligned means it gets desynchronized, right? Yeah. So this is how it will affect the digestion and the metabolism of nutrients, okay, in the body. So more than 3.5 hours of eating jet lag have been shown to actually increase the BMI in the study. The longer the more hours they have the period of delaying their meal, it will be seen to increase their body mass index. So this habit is not recommended, okay, generally in individuals who are especially trying to prevent or lose weight. Okay, so move on to the next one on the health outcome and the circadian clock. So the trends towards later timing of meal is very common among shift workers. So this has been seen in a model that was seen in shift workers. They have their aging factor is higher. They tend to develop diabetes earlier. They develop cardiovascular such as hypertension, poor sleep quality. Okay, just give me a minute. Yeah, I need to wait, yeah, I need to put my charger.
Okay.
Just give me a minute.
It's okay, take your time, Dr. Safinder. Adik-adik nanti kalau sesudah kuliah ini boleh bertanya ya kepada Dr. Satvinder ya. Boleh disiapkan pertanyaannya. So, all good now, Dr. Satvinder?
Yes, thank you.
Okay.
So sorry.
It's okay. Happened to me all the time as well.
Yeah, I forgot to plug in. Okay, yeah. Right. So this shows this model is coming back to how the circadian misalignment is found is basically in the group of shift workers. So if you go into the literature, you will see that this is how it is first seen, that a very clear thing. All right. So if you can see that this graph is among people who eat a late dinner. Okay, they eat late dinner and those who eat dinner earlier. So we must understand that when we consume our meal, that's why we have postprandial glucose. So glucose tolerance is always seen, it will peak and it will plateau back. So we can see that people who have generally at the evening time, all right, they eat early dinner. So they're still awake. And when they are still awake, their glucose peaks. On the other hand, people who eat a dinner later, their glucose actually peaks when they are sleeping, right? So this is a pattern that has been seen, okay? And in the morning, it peaks back. So this is a period of sleeping. People who have very close, their dinner is very close to their sleep time, okay? So consumption of meals in the morning and late evening plays a very important role in glucose metabolism. So having, as I mentioned, glucose tolerance and insulin will show circadian responses. And late evening meals may cause postprandial hyperglycemia with this decrease in glucose tolerance. So diurnal rhythm means is how it comes down, okay? An evening that will decrease of beta cell and insulin sensitivity. So towards the evening, our insulin is not very sensitive anymore compared to early time of the day. So loading too much of sugar, too much of carbohydrate can actually cause the blood glucose levels to not come down and it remains high, okay? So when we look at glycemic response, okay, dinner calories is higher, twofold will increase the risk of glucose intolerance. The misalignment in peripheral clock, it reduces. So glucose actually is very sensitive to the time of the day as well. The glucose, there's been more recent studies that showing this and affirming this theory now. And people who have very late night dinner, which is after 8 p.m., generally will increase their HbA1c. So as I mentioned just now, that is because of cortisol and the melatonin. After 8 p.m., the melatonin hormone goes up. So the body is actually going into a resting state. But when we eat so much, we are forcing the body to be active again, right? So that leads to, it's something like humans, yeah? Imagine you want to go to sleep. Then your mommy or your daddy or, wake you up. Hey, come help me wash the clothes, wash the dishes. Then you go like groggy, right? Like, you're maybe not so efficient. So similar concept. Yeah, similar concept, I would think. Okay. So eating concurrent with, so what happens this time? Melatonin is peaking, but we're eating. Melatonin, we want to rest, right? We want to rest. The body goes into a very slumber, resting, and that's how we go to sleep. If we go into that, you cannot be awake, you cannot be like dancing and suddenly jump on the bed and sleep. Never works like that. In fact, even when you do work, you realize your brain is very active, you cannot go to sleep, right? You feel like it takes some time for you to doze off. How to doze off better? You are more in a very quiet, you are putting yourself in that environment. So that's when your melatonin peak and you go to sleep. Okay, so what and how much of light? That's the question that we need to answer. And of course, when are we exposing ourselves to this light? So if you look at shift workers, right? So they are working in an artificial light. They go to factories, for example, and they are exposed to this light. So they have higher obesity, insulin resistant. Okay, all this has been documented. Not only that, they have also stress and social rhythm. Okay, it's not compatible with their daily meal, and they tend to have change in their appetite. Their hormone levels fluctuates. They have gastrointestinal functions. They don't feel, sometimes they have bloating. So they have a lot of health issues generally compared to people who are having a very normal work timing. Okay. So now I take you a little bit to my research that I do on maternal chrononutrition. Okay. Now, we have studied these 6 domains in our pregnant women: the breakfast skipping, the night eating, the largest meal of the day, the eating window, the meal frequency, and the meal timing, is what I've just explained in this lecture. So there have been various studies that has been done on a pregnant cohort. Okay, they have found that disrupting the chrononutrition is reduced their glycemic control and shorten the gestation length, meaning mothers are at risk of giving birth prematurely, and they also at higher risk of GDM, and they also have higher risk of excessive weight gain, right? So these are all actually modifiable factors that we want to educate our mothers in terms of gestational weight gain. There's a little bit of a trick here. It's in the sense that, if pregnant women, they come with various symptoms of pregnancy. So sometimes they cannot sleep at night, but educating them that eating at night or maybe eating unhealthy food at night puts them at a higher risk. So I think it cannot be neglected that this group of people, they would wake up at night. They would have problems sleeping, especially when they're closer to birth. However, with right education, we can minimize the impact, or we can ensure that whatever they eat at night is healthy, so eating, say, fruits that are not high in glucose response, so these are all important. What can they eat? So coming up with guidelines like that as a nutritionist is very important, that we guide them to eat better. So just a very brief, explanation. This was a cohort study whereby we followed the mother from second trimester, and we followed them up to birth, after the baby is 6 months old. And we did the study in Kuala Lumpur and several government clinics, in Kuala Lumpur. So this was done among women who had only one pregnancy. That means they don't have twins. But if they develop comorbidities in the study, like they develop GDM, hypertension, then we exclude them from the study. So what we found in this cohort of group is that the meal timing across trimesters. So the mothers generally start eating at 8:30 in the morning. Okay, and they have their morning snack, lunch, evening snack. So this is the mean time that we saw. And you can see most mothers are eating snacks up to 10:20 p.m. Okay, and in the third trimester, it's not very different. It's quite similar. You can see the pattern is generally quite consistent. Second and third trimester, they are eating around the same time. And in terms of the largest meal of the day, okay, when we look at the third trimester versus the second trimester, so we can see that, as I mentioned just now, breakfast is the smallest meal of the day. The largest happened to be at lunch, which is generally still not too bad, because having a large meal in the daytime is better than the nighttime. But it's also important that we take note that in the second trimester, these mothers, 42% of them are also having a large meal at dinner, right? So this shows that they are still eating a lot at the dinner time. And in terms of nighttime eating behavior, so we have seen that we have documented nighttime as eating less than 2 hours before bedtime, meaning they are eating time, and this could be their supper, okay, and that they're eating that's close to bed. So we can see that 63% of mothers are engaging in this, and it's somewhat dropped in the third trimester. Only 37% of them are doing this. But this could be because they might be waking up in between at night to also eat. So we ran some odds ratio analysis, and we found that, so what we did is, because we wanted to associate it with gestational weight gain, and gestational weight gain was grouped into excessive and inadequate, and we separated the model for analysis, whereby first we run to compare between the excessive gestational weight gain women versus those who have adequate. And we can see that if a mother skips breakfast, her risk of developing excessive gestational weight gain goes up to 3.8 times easily compared to a person who do not skip breakfast and have adequate GWG. Okay, so we can see in our work, mothers are skipping, mothers who gain excessive weight gain, they are skipping breakfast. Okay. And on the other hand, we also found that mothers who do not gain enough weight, they are also breakfast skippers. So again, it's a problem at the two arm. You skip breakfast, you could either gain too much of weight, or you could actually not gain enough weight throughout your pregnancy, right? So there are two parts that we have to focus on. So that shows that breakfast indeed has become an important meal that we must advocate mothers to eat. And it can be challenging at times, because mothers, women who are pregnant, comes with their symptoms, like they're vomiting, they're nauseated. So they may not feel very appetite, they don't have the appetite and they don't want to eat. So what can we do as nutritionists? How do we empower them, and how do we educate them or provide solution to this problem? Because if we don't tell them to eat something, we are allowing the body to align to the system. And if they do that, the tendency of them eating more later is higher, or could be they're not eating enough nutrient. So when they don't eat in the morning, they are having inadequate energy intake in the day, leading to reduced intake of important nutrients like protein, unsaturated fats that they need maybe in the morning for metabolism of the baby, So these are all important. And breakfast skipping has also been associated with increased risk of low birth weight, especially among mothers who have inadequate GWG. So of course, in terms of excessive gestational weight gain, they eat too much because they are so hungry after when they skip their meal in the breakfast, that by the time they hit lunch, they're so hungry, and they have very poor appetite control. Anything they see is attracts them. They become so maybe greedy after that, and they tend to start binging, and they will start craving. They will start to crave for food that is high in fats and sugar when they disrupt their hunger signals. And this will result in them having poor diet quality. Now, the other thing is what happens with excessive intake is that this term called compensatory eating. So when we shift our meal times, they will eat more at the next meal. So skipping breakfast will mean lunch is going to be large because I did not eat breakfast, so I compensate. It could be both psychologically or physiologically. Psychologically is we think that, oh, I didn't eat breakfast, I can eat more now. But loading yourself with one huge amount of calories at one time may not be advisable, especially for pregnant women. So this could lead to, having increased weight gain, particularly if women is having an evening type chronotype. So they tend to eat more than throughout the day, in the later part of the day. So now when we talk about changing on how we have obesity, should we change and how we manage obesity? All of you are future nutritionists. You're going to be advocacy. You're going to advocate. How do we do this? So these are some food for thought for you. We are living in an obesogenic environment whereby we cannot deny that our lifestyle is now changing. We have modern lifestyle factor. We are not longer traditional, right? Our work is no longer about sitting. Our work schedules are no longer confined to the traditional way whereby it only starts in the morning and ends in the evening. We can work around the globe these days. We can work across time zones. We can work at any time of the day because that's what technology is bringing in us. So we can't deny that the environment, the lifestyle is changing. So when we talk about dietary guidelines and we talk about healthy dietary pattern, what is missing from these guidelines? What is it that we're not putting inside? We are telling people, all country has a very comprehensive dietary guideline. We are telling people, eat your vegetables, eat your fruits, eat your complex carb. But what's missing in this guideline? Are we telling people how to eat? Or we are just telling them what to eat? So I know what to eat, but I tend to eat everything. My carbohydrates is loaded at dinner. I'm eating my fruits and vegetables only at breakfast, making it very small. So is that someone who follows a guideline but doesn't follow the concept of time? Could that be the problem, right? So tuning individuals to eat based on time, could this actually be the trick that we are missing? We are telling people, we're forgetting to tell people, hey, you should eat this in the morning. Your protein, your NG should be more in the morning, not at night. And the compliance to diet regimes is always a constant challenge. Yeah, if you talk to about promotion, health promotion, it's a very challenging field if you ask me, because it is associated with behavior. We have to tell people to actually change not just what they eat, but basically we are telling them to change their social lifestyle in a way, right? And it's time to address our time besides our quality and quantity moving forward, forward thinking 10 years from now, how are we going to address this? And the pandemic, right? We forgot about the pandemic. Actually, how did it alter the alignment of human chronobiology? Did people eat better? There were some studies that showed that people ate better. They lost better. They lost more weight during the pandemic. Why? Because the pandemic was a time where your weekend and your weekday is the same time. You don't have to rush for work. There's no traffic jam to beat, right? So a lot of people were living, they're working, but they're working at home. So they were consistent. So you could go, and there were studies that showed that during the pandemic, people ate healthier because they cannot eat out. You have to eat at home. You have to cook your food, and you have to eat at a certain time. You sleep at a certain time because you have no nightlife. You cannot go shopping, right? So these are all food for thought. How did the pandemic could it become a model that we mimic or we advocate on how we talk about ensuring that a person, eat and based on the time. Could this be something we all have been neglecting from our guidelines? So observe our environment is a small take-home message. It is actually sending you a message on your eating. So be more attentive to your body. The cues are there. Sometimes we neglect those cues. So actually when it's dark, it is actually telling us it's time to go to bed and sleep. Right? It's not the time to be awake because your body is actually being programmed to sleep and your programming starts from the morning. Okay. So you are when you eat, no longer you are what you eat. Okay. So I believe in this concept of you are when you eat. And hopefully we as nutritionists, we can do more work or more research in this field, especially in Southeast Asia, whereby our culture and the way we live is different from the Western side, right? Even from our East Oriental Asian side, we are different. We have very different cultures. So we need more research. We need more information on how we can incorporate this and educate our people about this concept and embed it in their lifestyle. Yep. So that's my email. If you have any questions for me, right, feel free to reach out to me. And yeah, finally, thank you for all your attention and this invitation to share this topic that's very interesting and close to my heart. Okay, thank
Okay.
you.
Thank you very much, Dr. Satpinder. Well, if we are in the audience, in the auditorium now, I would like to invite everybody to give an applause. Everybody can give applause from their place.
Thank
Well,
thank
students, this is such an insightful lecture. Thank you very much, Dr. Satpinder, for sharing with us such a complete explanation, starting from the definition on chrononutrition and the pathophysiology on how the biological clock affecting our dietary pattern, dietary intake, and then the recommendations on optimizing the chrononutritions to achieve a better metabolic health outcomes. I would like to maybe underline a bit some of your important points. For example, it is already becoming more well established that sleeping habit and biological clocks influence our dietary intake and dietary pattern, and that it is recommended to eat more during the day, including not skipping breakfast, students. And this is recommended due to enhance the chance of energy expenditure if you eat more during the day, because you tend to move about a lot and then doing things that actually expand your energy. And then the diet-induced thermogenesis is actually also higher in the morning than nighttime. And that late night eating, although it is not so conclusive that it leads directly to weight gain, but it leads to detrimental metabolic health. So those who are eating late at night, they experiencing type 2 diabetes and cardiovascular diseases earlier. And late night eating also burdens our digestive systems. It does not give our digestive system the rest that it deserves. That is why it may explain the detrimental health outcomes that come through late night eating. Okay, and it is also a good point that you raised at your last slide, because also in Indonesia, actually the national guideline for the healthy diets is only dictates us on what is good to eat, but not also integrating yet the timing of the meal. So maybe it is also the homework for all of you, the future Minister of Health in Indonesia, to start integrating this concept of chrononutrition in the national dietary guideline. Okay, I would like to now open the question and answer sessions to our students. For those of you who have burning questions that you would like to ask to Dr. Satpinder, now it's the time. Okay, thank you so much, Trifosa. Thank you so much, Trifosa, Zaidan, and Trasha. And Amira, thank you so much. I already see many questions here from the students. Can we start from Trifosa, maybe? Trifosa, please.
Okay. Thank you so much for the opportunity, Dr. Fatima, and thank you so much for your very insightful lecture, Dr. Satvinder. Right here, since most of us here are girls who will possibly be a mother in the future, I'm interested in chrononutrition on breastfeeding mother. What about breastfeeding mother who have to breastfeed every night repeatedly? Like they need to do it either to maintain normal amount of breast milk production or to fulfill the baby's demand. Is there any effect of chrononutrition for the mother and the baby to this case, or maybe any recommendation for breastfeeding mothers? That's it.
Right.
Thank you so much.
Thank you, Trifosa. Hope I got your name right. Yeah, that's very interesting. So currently we're also doing some work on infant circadian rhythm, my current PhD student. So we are looking at how the babies are in a way sleeping throughout the day to see, the rhythmicity there. Now, actually the breastfeeding part is actually very important because the breast milk, we did not study, but yes, it's been seen in many literature that breast milk contains melatonin. And when a baby is breastfed at night, the baby sleeps better. So, for women who are expressing their breast milk, it's very important even now when they give the baby the breast milk, they should give in accordance to the time that they express the breast milk. For example, if the breast milk is expressed at 2 a.m., then that milk should be given at around early morning. It should not be given at 2 p.m. That will make the baby sleep. And then you give the 2 p.m. milk at 2 a.m. The baby is happy and crying, and the mommy cannot sleep. So direct breastfeeding is definitely firstly encouraged and most recommended to ensure on this. So in terms of the disruption of the chrono, yes, definitely the mother will have disruption in her sleep, but she would still be producing the melatonin in her body. So you could see a deattenuation in the first 3 months, and that's when the mother is struggling, to establish the rhythm. But if the mother, generally, if you look at studies, when mommy sleeps, baby will sleep. But if the mother is awake and the baby is awake and they're playing, you are encouraging the baby to remain awake. Circadian rhythm is not established until the first 12 weeks of life. So at 8 weeks, first 3 months, baby got no circadian rhythm, not like adult, right? But that's why it's important to mothers to instill the habit. So if a mother breastfeeds a baby and it's consuming higher melatonin at night, the baby will sleep better. And you will notice that the sleep period for the infant gets longer and longer after 4 weeks of age. So yes, it will be disruptive. So it's important for the mothers to be reminded to not consume meals so your mother should not, when they wake up and breastfeeding the baby, and eat food, like unhealthy food. They could snack because they may be hungry, but they should focus on healthier snacks, complex carbohydrate, that will not impact their health in the long run, because this is a very temporary, as I showed in the presentation, a short-term change will not have a significant metabolic outcome to the individual. It's about the long-term change that we want to address here. Yeah.
Okay.
Hope I answered your question.
Okay. Thank you so much for the answers, Dr. Satvinder, and also the question, Trifosa. I would like to now give the opportunity for Zaidan to ask his question. Please go ahead, Zaidan.
Okay, thanks for the opportunity, Dr. Fatima, and thanks for the material, Dr. Fatin. But I want to ask, so earlier we heard about window eating when we're eating about 8 hours of our time. But what when we are fasting, we are eat about in 3 or 4 a.m. and eat again in 7 or 8 p.m. kan? Will that gonna affect our body metabolism or affect chrononutrition for our body? And how that we keep our metabolism and chrononutrition is healthy gitu. Thank you.
Sorry, if you don't mind repeating the first part of your question again.
Apa? What if when we are fasting gitu? When we are fast, we actually have breakfast at 3 or 4 a.m. and we will eat again at 7 or 8 p.m. Will that gonna affect our body metabolism and chrononutrition, and how to keep our metabolism healthy and when
Okay.
when we are fasting?
Okay. So Fasting is actually the right way to eat. You eat right before sunrise, am I right? You eat right before the sunrise, and it depends on the place. I do not think you eat at 3 to 4 a.m. If you eat correctly at the concept of sunrise, say 6 a.m. sunrise, so you should be eating anywhere between 5 to 6 a.m., right? That is the timing that you should be consuming. That means 1 hour from your sunrise before your sahur ends, right? Before your sahur ends, 1 hour before. So you eat at that time. But if you eat at 3 to 4 a.m., you're actually eating too early, right? So maybe that's not recommended. And then you eat again after the sunset. Okay, the moment the sunset, you eat within the 1 hour of the sunset. So say the sunset at 7 p.m. Okay, 7 p.m. So if you're actually a sunrise at 6 a.m., you generally will eat anytime between 6:30 to 7:30 p.m. That's the normally depending on exactly what time the sun sets. And you should eat immediately again to load yourself, okay, with the energy. But the concept of fasting, I mean, correct me if I'm wrong, but if I go into the literature, it never encourages you to eat too much, right? The concept of fasting, if you talk about religiously, is even the concept of being moderate with your food. So the problem in today's modern life, which we also see in many studies as showing that there's too much of options that are given, that may not be the way. But I have, even my own friends who I know that they practice it correctly, they actually lose weight during the fasting month. So done right, fasting is a good concept. Yeah, so I think the answer to your question is doing it right, doing it in moderation, doing it in a balanced diet, and not in a diet that is high in sugar, high in calories, right? So if you eat too much after you break your fast and then you continue to eat, you're eating at 7 p.m. until you eat until 3 a.m., 4 a.m., then that's not the right way. Right? So the method of doing it then becomes wrong. But if you do it in the context of the correct, so when you're fasting, clearly you cannot eat in the day, but when you can eat, you keep your window of eating shorter, meaning 1 hour from before you can stop fasting and open buka puasa, then I think, and eating the right food. Yeah, that should be the way you manage your metabolic health.
Okay, thank you very much for the answer, Dr. Sarvinder. Maybe I just want to clarify a bit Zaidan questions because in Indonesia it is actually true that people tend to wake up at 3 during the Ramadan because in here the sahur ends is at 4:30.
Oh, it's quite early. In Malaysia,
Yeah, so
6 a.m.
yeah. I noticed that we have 1 hour difference, but maybe what Zaidan meant for the buka puasa is not at 8. I believe that people in Indonesia, they just break their fast immediately at 5:45 or 6.
Oh, that
So
is
it is
very
not.
early. So
Yeah, so I mean, the buka puasa, the breaking the end of the fasting hour is around at
earlier.
6. So, well, I mean, it's actually the same as in Malaysia, but 1 hour earlier for the
Yeah.
sahur ends, and then 1 hour earlier for the buka puasa. So,
Yeah.
in a sense, it is still the same, but I think the answer is correct. I mean, the way that people tend to do Ramadan fasting in Indonesia is not only about religious itself. In Indonesia, the Ramadan is kind of like a culture. So, well, I guess all of my students here aware that within the Ramadan period, the fasting month, everybody, street vendors, food stalls, every sugary drinks, whatever is
Yeah.
being very widely available. Home industry start selling their products, and it is somehow creating the environment that we have to eat a lot of sugars and a lot of carbs. Everybody, the goreng and everything that the street vendors sell. So I think your answer answers Zaidan's question perfectly. It is the matter of moderations or controlling ourselves in what to eat during the Ramadan fasting. I guess it clarifies Zaidan concern as well because the timing difference in Depok and Malaysia maybe also play a role in here. Can I give the opportunity for another students to ask question, Dr. Satvinder?
Yes, sure. Go ahead.
We still have Trasha, Amira, Valerie, and Anissa to their questions. Maybe we start from Trasha first. Trasha, go ahead.
Thank you, Dr. Fatima, for the opportunity. Thank you so much, Dr. Satvin. It's very insightful. It's like for the first time I heard about chrononutrition. So I have some follow-up questions. You previously discussed about night shift workers and its impact on their metabolic circulation. But I'm also curious about individuals who frequently move around time zones, like taking long distance trips, countries to countries. Like maybe I guess you also often take long distance trip for international conference, right? What solution can be recommended for occupations like maybe extremely pilot? And what steps can people who frequently travel take to minimize the impact on their metabolism? Thank you.
So that's a very interesting question. People that I know in my field, including myself, what I do, I try my best, is to look at my flight timing. I try my best not to disrupt it. And of course, if it's unavoided, I have no choice. Like I just came back from Bangkok yesterday, was a bit of a late night, So nevertheless, I noticed that because if you start practicing this, right, even by practice myself, your body can't sleep beyond a certain time. It's you tend to become very regulated with that system. You could do of 30 minutes or maximum an hour away from your own sleep time, but you generally that one day you'll be very tired, you could be sleeping, you'll be napping or having what we call micro sleep in between the day. But the idea is not to succumb to it, not to go and sleep like throughout the day, and not to allow your body to do that, because then you are really disrupting the rhythm. So the idea about people recovering from their jet lag is to just continue their routine. Right, continue their routine and ensure that they catch up on the sleep just at the night time. So if they have the daytime, you're already awake, although you maybe land in the morning, then you have to, you could sleep in the morning, but you still remain awake. You could just end your day a bit earlier and go to sleep. So that's one of the way. The strategy is never to disrupt your rhythm, even though you travel. So these are always 1-2 days gap, and they are generally not harmful. But what happens with most people is they succumb to it. They didn't sleep the whole night. They come back, they close their room, and they go and sleep. And then they notice, these are the group of people will notice that they need longer to recover. They might go 2 days, 3 days. Some people after 1 week say, I'm still having jet lag, but that should not be the reason. The other thing where I've heard some people do is consuming melatonin supplement to help them to sleep better. Now, in over here in Malaysia, it's not an OTC supplement. It's not over the counter, but places like Singapore, you can generally just buy it. And some people actually do that. So what happens is when they are traveling at night in a flight, they take the melatonin to help them, nap a little bit. So the secretion is still there. The secretion is still there. So it's easier when they go back and they can sleep better once they reach home. So to answer your question is not to disrupt your cycle. And if it's within a person's ability, is to still maintain and try to find schedules or timings of flight that matches your, the right, try to plan your travels accordingly. That will be the best way to do it. But if it's not unavoidable, don't disrupt it. Go through that one day and end your day earlier to sleep longer to catch up on your sleep. So the next day you'll be very fresh and all back to normal. Yeah.
Okay, thank you so much, Dr. Satvinder and Trasha, for the nice questions and answers. We still have Amira. Amira, do you want to ask your question now?
Yes, Dr. Fat, thank you so much. First, thank you so much, Dr. Savin, for your comprehensive explanation on chrononutrition. So my question is, Indonesia currently has a new program called Free Lunch Program. So let me explain it a bit. Yeah. In this program, the school-age children from elementary school until high school will be given free lunch. I'm somehow concerning this as it can increasing the likelihood of children skipping breakfast because they might think they will receive free lunch. On the other hand, I remember what you've said before that eating much in daytime may give a good impact in our health. I wish I can get some insight from your argument and perspective regarding the possibility of this program that will be implemented in Indonesia next year. Thank you.
All right, welcome. So this program is in all schools, right? It's a free lunch program, and that is being given to children. Firstly, I must say congratulations to Indonesia to implement this very good program. I think for children, it's one of the best things that can be done, because when a meal program is given in school, it's given with guidance. There will be nutritionists involved. There'll be proper, food supply. There should not be a concern of children skipping breakfast. Of course, we still want children to eat breakfast. But the concern, I think, where your government sector or in generally all, even Malaysia, we are mulling on the same issue, is that we don't want our children not to have a healthy diet. They must have a good, food in the day. And having a good lunch is more wholesome. Now, most of the time, why lunch would have been chosen instead of breakfast is because breakfast, there's an issue. It could be timing, it could be logistics, it could be many factors, right? Because in order for the school to prepare the meal, they have to start cooking early. So I think that when we talk about the supply, the logistic, that's the back end of it that we also have to factor. But having a lunch, which means most children eat lunch, 90%. But yes, there are children who skip breakfast, right? But 90%, almost close to 100%, all kids would eat lunch. So that becomes a meal to target, because there will be no question arise that it will be wastage or no uptake. Now, in terms of skipping breakfast, I do not think that such program will actually encourage. I'm not sure how Indonesia is going to run it, but I'm pretty confident. Maybe Dr. Fatima can share more about this program that's going to be launched. I'm pretty sure there might be some nutrition education that is going to come with it, and with that kind of a focus, slowly, I know you're starting with baby steps, but that's a very fantastic thing to do. That can actually create, so through this education, you could tell kids. So to answer your question, I do not think such program can hinder. In fact, I think such program will improve their eating habits of children in Indonesia and tackle many other health issues and prevent other comorbidities too, in children. Yeah.
Okay. Thank you so much, Amira, for raising the questions. And also thank you so much, Dr. Satvinder, for your insight. Well, indeed, it is now heavily discussed, the free lunch program for schools, as it is actually brought up by the newly elected president. So why it is still heavily discussed? Because at the moment, there is still no kind of like operational standard procedure on what is actually in the lunch and how it is distributed. So everything is still in the, I don't know, development stage at the government. So I guess it is also homework for us as academics at universities to also follow the developmental progress of the regulations, and maybe also being integrated with the government to given some nutritional guidelines. I'm not sure if the nutritional education program will also be provided along the free lunch. Uh, I hope it does. But for now, I cannot really say anything about the nutritional education program, although maybe that is something that I would like to recommend to government to implement as well. Okay. I know that it's already 10 minutes past the lecture time, but we still have three questions. Do you mind still staying with us,
Yes,
Dr.
yes, yes,
Satvinder?
yes, yes.
Okay. So the next question is from Valerie. Valerie, do you want to ask your question now?
Thank you, Dr. Fatima, and thank you to Dr. Lavender for the amazing presentation. I really enjoyed it. I want to ask more about the social jet lag and eating jet lag concept, because I've seen people around me um, take that concept to like a more extreme level. There's people around me who tends to have different eating habits every day. So they can maybe skip breakfast one day and maybe eat breakfast one day in different time. So I want, especially I can see this being more prevalent during menstrual cycles, because even I myself during my menstrual cycle, I can feel like I have different eating habits during my menstrual cycle, or when I'm not in my menstrual cycle. So I want to ask you about how can we know what's going to happen to our body when we're doing like social jet lag and eating jet lag to a whole more extreme stage like that.
Yeah. So I think if you say you know person who has very bad eating habits, so when I take it that when you say habits, it's about timing. Yeah, that means it's quite irregular, erratic. So I do not think so. If this is a long-term thing, it's not recommended definitely. So this person or people who are doing this, they will see that they have very poor control of their weight as they age. Now, if they are talking about youth, yeah, so I always tell this to my students as well. So now you are in this 19, 20, 21, you are actually in the peak of your youth. You are like, if you talk about car models, you're like Lamborghini, you're like Porsches, you are like the optimum performance of your life, So if you do things now, you rarely see any impact yet. You rarely see. But because it's a habit, your body is recognizing this as a habit. The moment you skip another decade of your life, which you go into 30, you tend to degrade. Then you become like a Mercedes-Benz, a BMW, So still optimum, but not as efficient as in your youth. And then you shift another decade, which is in your 40s, then you become more like, the continental cars like Toyota, Honda, And then you tend to degrade even more. So what I'm trying to say is that our body is not what you do today is never about what you are or your health today. It's always going to be a domino effect to what you're going to be when you are aging, especially in your 30s, 40s. So you brought a very interesting point about menstrual cycle, which a lot of women today are having a problem of anemia. And we have found in our recent work that most of our anemic girls are breakfast keepers. So which means the quality of the diet could be poor, and generally they do not eat very well. And that could be one of the contributing factor of why they develop anemia. So again, it's not something that is impairing their quality of life at this point of time because you're still very optimum. So the impact here will not be in the short term. As we also seen in studies done, the impact here will be in the long term. Because if this person that you're giving reference to is not having a aligned system, you are literally telling your body to metabolize glucose, your lipids in a very erratic manner, day to day to day. And your body doesn't have a synchronization. So it's attenuated, we call it, right? And over time, this particular person is with the one that will be higher risk of developing obesity, diabetes, and, other comorbidities. Yep. I hope I answer your question.
Okay, thank you. So I think it is good to know to Valerie that your health is like a sum up of your habit. So one slight change in daily dimension may not give direct impact, but habituations of bad habits will eventually do something for your health. Okay, and Anissa, can we have your question now?
Okay, thank you, Dr. Fatima, for the opportunity, and thank you, Dr. Satfin, for the great lecture that you delivered before. I want to ask about the intermittent fasting that many diabetes people do for manage their glucose tolerance. But what I want to ask is, how about if they do their intermittent fasting with skip their breakfast and eat a lot at early night because they think that it is easier to hold their urge to breakfast instead of hold their urge for dinner.
Yeah. So as I mentioned during my talk, even intermittent fasting concept is good. Okay, good, because you are allowing your body to give that break, right? Similarly with fasting. However, the way to do it is something that we need to advocate better. So skipping breakfast is definitely not the way to go, because your body needs the energy in the morning, right? All the most important thing we do is always in the morning and with the sunrise. The sun is an indicator. So that's why when the sun is at its peak, we are always at the peak of what we are doing in the day. It's a midday already, right? And after that, even after lunch, sometimes you tend to slow down a little bit. Okay, you tend to drop. So similarly, skipping breakfast is not the right way. Intermittent fasting concept is not wrong, but if it incorporates eating later in the day and then extending it up to night, then it's not the correct way to do it. Instead, it should start early in the day and end earlier in the day. So maybe stopping, say, by 4 or 5 p.m. Some people stop at 3 p.m. is very ideal, but people who stop at 3 p.m., one thing is certain, they must sleep early. So people who stop eating by 3, 4 p.m., right, generally they should sleep by 8, 9 p.m. because that's the only way the body can conserve their energy. They won't have energy to go beyond that. So they will succumb to eating more. So we must remember that once we don't eat after 3, 4 hours, our body need to conserve energy. If you look at the concept of energy metabolism, so that's the best time to go to sleep. And extending the time will make them have more urges to eat actually. So I hope I answer your question.
But can I have like a follow-up question?
Sure.
Okay, if someone do that wrong intermittent fasting method, is it still effective for their managing glucose tolerance? No.
No,
Oh,
you will
okay.
notice. Yeah, you will notice in people who do this. I mean, I know someone who does this actually, and I can see in the start of doing it, they will lose weight because you know why? Your body is recognizing this as something new. It's a drastic change. From eating every time, you suddenly don't eat. So your body changes the system, but then it's not consistent. So the person's intermittent fasting, this week is say morning to evening. Next week is evening to night. There's no consistency in that. So when there's no consistency, the attenuation is not achieved. So the body's response to glucose will be very poorer. In fact, this particular person I know has gained a lot of weight. So even though the concept of intermittent fasting was there in the beginning to bring benefit, but because it was not done correctly, I'm talking this in a span of 3 to 4 years. I'm not talking this in 6 months. I'm talking 3 to 4 years. The effect is no more there. In fact, it can be more harmful in bringing the right, because you are forcing the body to go into a very different state than you already know. So so it's never about changing your system suddenly and drastically. It's about maintaining the system that you have achieved. So in that maintenance, you must ensure that we cannot deny diet quality. Diet intake is still very important. We are incorporating a new concept of how we use this diet intake and quality in a more rightful manner, aligning to our body system. So that's the whole idea of chrononutrition, because we have seen that our body is very effective in regulating blood glucose level in the daytime, and the secretion is better in the daytime compared to nighttime.
Okay, thank you so much, Doctor,
Thank
for
you.
the explanation.
Okay, thank you so much, Dr. Satvinder. Do you still have time for one last question
Yes,
from
sure.
Richard?
Yes.
Okay, Richard, go
Waiting for
ahead, your
long.
question.
Okay, thank you for the opportunity, Dr. Fatima, and thank you also for the presentation and the lecture, Dr. Satvinder. So in the presentation, it is recommended to eat smaller meals at nighttime. But in here, some adults do sports or exercises at night because of their work and business in the daytime. And I heard that it is recommended to eat around 1 to 2 hours before doing the exercise. And for me personally, I usually eat a lot of carbohydrates to prepare the energy needed for the exercise, like rice and potatoes. My question is that should we eat larger meals or smaller meals?
Okay. Thank you for that really interesting question. So actually, although there is chrononutrition, there's also chrono exercise. So chrono exercise does not advocate us to exercise vigorously at night. Yeah, so we should exercise. Most efficient exercise is actually either in the morning, and you are correct. You should exercise after you have your meals because your body is most efficient in burning and you need the energy. So it's very contrary to what we always hear, exercise in an empty stomach. That's actually becoming very giving a lot of like stress to the body. Right? So yes, you are very right in that what you have said, exercising and eating carbohydrate and protein before you exercise. Carbohydrate more before and protein is always after for recovery, right? But yes, in the field of chrono exercise that has been done in some studies in Japan, see the best time to actually regulate blood glucose level is to do exercise in the late evening, not at night, okay, late evening. And in fact, at night, vigorous exercise is not good for the heart, right? Because as I mentioned just now, when we want to go to sleep, we need the heart rate to come down. But now you're forcing your heart rate to go up. You cannot sleep. You cannot have a good sleep, So that would actually impair in some way your mechanism of it. So that's very important for us to recognize. So when you exercise even, you will notice you can't go to bed very early. You have to wait for your body to recover. Go back because your heart rate is very high. It can be close up to 180, 190. If you do intensive exercises, can go beyond 200 if you do very vigorous exercise, right? But then when you exercise, you cannot secrete melatonin because you're making your body very active. You're not going into slumber. So that is opposed of your circadian system again. So exercise should also be in the daytime and preferably in the evening. However, after you have your meals at night, it is recommended you can do, so this is a very new data. In fact, it was just shared by my collaborator. I think they are yet to publish the work. I think he presented to us just a few months ago, whereby he shared that when they look at their respondents who, and this was monitored using the CGMS method, where this group of people, when they consume their dinner and they go for a walk, a very brisk walk, no, I wouldn't say brisk walk, just go a light walk after your dinner, or generally being active, not sitting down watching TV, they are walking, they had better blood glucose response in terms of, from their dinner meal, as compared to people who just sat and be sedentary and go to bed. So it shows that having some kind of activity helps after dinner, but it should not be vigorous. So sometimes, it's a very traditional, I'm not sure in Indonesia, but over here in Malaysia, even when I was growing up, maybe at that time we don't have technology, we don't have much, the dependency on TV is less. So a lot of time what families used to do is after their meals, they go for a short walk, just a very simple walk, one round, and then they come back, they have a good sleep. So it has been shown that this practice is more, it's better. So having too vigorous exercise is not recommended at night time. Right? And you can read up a little bit more on chrono exercise, which is also another field if you have interest in sports nutrition, which they are looking, there's a lot of people that are doing this exercise, this research and seeing the best time to exercise in the day. Yeah.
Okay.
For the answer, Dr. Satvinder.
Okay, thank you so much, Richard, for your questions. I hope Dr. Satvinder's answers your question. So students, thanks a lot for staying with me. Thank you also so much, Dr. Satvinder, for staying with us in this session. This is such a fruitful lecture. And I am also proud of my students who are brave to ask for their questions that really enlighten our knowledge on the topic of chrononutrition. And also thank you very much, Dr. Satvinder, for providing us with insightful answers that really complete our comprehensions and understanding in this topic. So
yeah, I think your students are, I must say this, being a lecturer, you guys are very, very attentive and very good. I have so many questions. I'm so happy to answer them, and that just shows that you are paying attention to what and I see there's this one cute cartoon keep moving in front of me, so cute, Siti Arifah. She's using a cartoon. It's so cute, and she's moving.
okay,
So
actually,
yeah.
Actually, Ibu Siti Arifah is one of the lecturer at our department.
Oh,
Yeah.
okay. Yeah, I see. I find that so unique. I
Yeah.
rarely see this cartoon and character, but yeah.
Yeah. We will invite you in person to the University of Indonesia in the future, and you will meet her in person.
Okay,
She
that'll
is
be
indeed a
great.
very humorous person.
Okay, that explains.
Okay, I think it's now the time to end this session. But before I end this session, I would like everybody to turning on their camera again because we want you take another screenshot for the attendance list because we see that some of the attendants here are not present when we start the session. And Kak Novi will help me again screen capturing the attendance for the attendance list. Kak Novi, are you still there? Or maybe Mbak Puput? Can I ask Mbak Puput to help me?
Of course, I will try.
Okay. I think you will need to screenshot a few pages because we have 150 participants at this
Yeah,
session. Please go ahead, Mbak Puput.
this is
Okay, I will take a
this is
first
generally
peek.
your attendance, yeah, for your sessions. Amazing. Very good.
And then going to the second page, please still turn on the camera. And we're going to the third. And then four, please wait a moment. And we're going to the five this time. And the last, going with the six. And one, two, three. Okay, Dr. Fatima, this is finished. I take the pictures.
Thank you so much, Ibu Puput, for helping me with the attendance list. And I would like to thank you again, Dr. Satvinder, for spending your time. It is such a precious opportunity for us. It is really broadening the horizons of our students on this topic that is actually very rarely or maybe not yet discussed,
Yeah.
especially for the first and second year students. And I also would like to say thanks to all of my students. You are indeed showing Dr. Satvinder the spirit of FKM. And I hope that in the next session, in the next guest lecture, you can also still show this kind of spirit and enthusiasm to our future guest lecturers. Okay. Thank you very much, everybody. Thank you very much, Dr. Satvinder. I hope to see you again in the next opportunity. And also students, thank you very much. Don't forget to submit your resume. And
Yeah.
I wish you enjoy the rest of your day. Eat more during the day and spend less meal
At
during
night
today.
and sleep on time.
Okay, we are what
Yeah.
we eat.
Spread the
We are
chrono.
when we eat.
Yes, yes, we
Okay,
know.
bye
Thank you.
bye.
Thank you,
Bye.
everyone. Thank
Good afternoon,
you.
everybody.
Bye.
Bye.